It's like a pole.
Let's begin with the introduction.
Coronavirus disease, that also known as Covid-19, is a pandemic that has taken millions of lives in this world. The first case is reported in Wuhan, China on 31 December 2019, before it started to spread worldwide. Malaysia is one of the countries that have been greatly impacted by this pandemic. The first case in Malaysia was confirmed on 4 February 2020 from the 41-year-old man that just returned from Singapore. To control the pandemic, Malaysia has put all the efforts and take many measures to make sure our country to be free from this pandemic. Ministry of Health is the one that stands at the front line that responsible for the health system in Malaysia. Many countermeasures and plans that we can see from this ministry on how they manage Covid-19 in Malaysia. It can't be denied that Covid-19 gives a big impact to our country. The loss of lives of 1,000 people that have already reached 2.80 million cases and more than 31,000 deaths in our country. This pandemic also has a significant impact on our economy because most of the sector can't be operating as usual. In addition, education sector that makes school and university can't be open has caused an uproar because students need to learn with new norms that give a difficulty especially to the examination student. Mental health is also one of the impact of this pandemic because of the movement control order that have been enforced by the government have prohibited anyone to go outside.
Next is planning.
There are many plans made by Ministry of Health and the government to control COVID-19 from continuing to spread in our country. Among the plans implemented by the government is to implement the Movement Control Order (MCO) to the people so that the COVID-19 chain does not continue. If the Movement Control Order (MCO) is not implemented, this will result in our country not being able to control this COVID-19 epidemic infection case. In addition, the Ministry of Health has planned this short-term plan including health guidelines and safe operating method in the new norms, capacity building, recruitment and job creation, as well as increasing consumer spending, especially through digital channel with new means of operation. The people need to accept and live in the new norm for which we need to follow the procedure SOP that have been set to break this COVID-19 chain. As for long-term plan, the Ministry of Health plans to provide booster doses and additional doses in line with the recommendation given by the Strategic Advisory Group of Immunization Specialized Surgeons. The World Health Organization (WHO) also recommends that this booster dose be given especially to those with low immunity such as the elderly, aged 60 and above, and also frontline group. A panel of physicians (MOH) has examined the efficacy and safety of booster doses from various sources and found that one booster dose can increase a person's level of immunity to COVID-19. Not to be outdone, the party that had a lot in implementing the plan to deal with COVID-19 is the Association of Private Hospital Malaysia (APHM). Private hospital expressed a full commitment to work together in helping the government to address the COVID-19 pandemic, depending on the capacity and capability required. They are also ready to help if the state-recorded COVID-19 cases increase dramatically and many patients need immediate treatment.
The next part is organizing.
Organizing is a method for coordinating human activities, gathering resources, and combining them into a cohesive whole that may be used to achieve certain goals effectively and successfully. As we all know, the COVID-19 virus has been an issue in Malaysia. Therefore, Malaysia's Ministry of Health will monitor COVID-19 infection rates and the progression of this infection through information collected from the World Health Organization. The Malaysian citizen will be kept up to date on any new developments. The importance of organizing is that the Ministry of Health allocates workload to all members in order to achieve a common aim of filling the COVID-19 rate. The first solution is work specialization. Work specialization refers to the division of work activities into different job responsibilities. The Royal Malaysia Police and the Malaysia Armed Forces are responsible for maintaining roadblocks by checking vehicles passing by. Meanwhile, patrolling the region is done by the Malaysian Volunteer Department. In terms of financial assistance, non-governmental organisation helps the government. The second solution is span of control. It refers to the total number of employees who report to a specific manager. As positive cases increase, as reported by MOH and PRES during the third wave of COVID-19, school closures were made across the country based on analysis of positive case dates, close ties and quarantine among students, teachers and school staff. Senior Minister of Education, Dr. Razi Chidin, said the ministry's data found that when there were positive cases in the district, student attendance to school would be affected. The ministry feels that attempts to prevent the epidemic spread are important to guarantee that the 2021 school year can begin without an issue.
Next is decision-making.
Decision-making is a prepare of recognizing and selecting a course of activity to illuminate a particular issue. It is to prepare to streamline of the organization for includes the method distinguishing issues elective to illuminate the COVID-19 pandemic. Next is strategies to undertaken COVID-19 pandemic in context decision making. First is to do a decision. It must follow 4 steps, which is identifying the issue, generating alternatives, implementing the decision, and controlling the decision. Firstly, strategies to undertaken COVID-19 pandemic in context decision making is Dr. Noor Hisham make a decision, which is make a strategy about the COVID-19 vaccine. After observing that MCO 1.0 does not have a significant effect to Malaysia, the state government must provide the infrastructure to launch the national immunization program to meet the aspirations of the Malaysian Ministry of Health to achieve 100% immunization for Malaysians. Then MOH also approved when Tan Sri Muhyiddin make a decision to volunteer to be the first people to receive the COVID-19 vaccine. This main strategy is ensuring the COVID-19 vaccine is set for Malaysian citizens. Secondly, imposing a compound to the citizens that don't follow standard operating system SOP. To ensure the safety of the people, the Malaysian Ministry of Health recommends and mandates the use of face masks at all times when outside the house, especially in places where people gather. This is one of the ways to avoid being infected with COVID-19. Social distancing is also one of the SOP that have been outlined by practicing the practice of imprisonment exceeding 1 meter from each other. The effectiveness of social distancing can also be considered to ensure that this pandemic can be controlled from spreading further. Thirdly, quarantine also implemented by government to ensure that people who have symptoms and are confirmed positive for COVID-19 are not free to move to ensure that the disease does not affect others. Therefore, every infected person will be admitted to the quarantine centers that have been opened in each area to ensure that the spread of the epidemic can be fully controlled. Lastly, strategies to undertaken COVID-19 pandemic in context decision-making is provide Bantuan Prihatin Nasional BPN 2.0. BPN is an additional assistance provided by the government to the B14 and M14 groups to alleviate their burden due to the effects of the COVID-19 pandemic. In the presentation of the national budget announced by the Minister of Finance, various packages and assistance were given to all levels of society, including all agencies, to ensure that the country's economy recovers quickly in the short and long term.
Let's move on to controlling.
Controlling is a method in curbing the transmission of COVID-19 virus. Screening, containment, and mitigation are all strategies for controlling an outbreak. To detect the high body temperature associated with fevers produced by the coronavirus, screening is done with a device such as a thermometer. When containing the disease is no longer viable, efforts shift to mitigation, which include taking steps to reduce the disease spread and mitigate its impact on the healthcare system and society. As a result, during the mitigation phase, the Ministry of Health (MOH) and the government devised a combination of movement control order (MCO) measures and targeted screening procedures. This was done to establish a limited window of opportunity for breaking the virus transmission cycle. To begin with, the government's adoption of the MCO in restricting mass movement aimed to achieve 2 goals: reducing the transmission chain in the community and allowing the Ministry of Health to track, isolate, and manage the discovered positive cases. Secondly, with the restriction on travel in place, the MOH will be able to fully screen and control existing clusters, preventing infection from spreading beyond the first or second generation. Because the COVID-19 situation changes regularly, standardized operating procedures (SOP) were required for healthcare providers and the public to refer to. As a result, academics and statisticians frequently collaborated with the government in giving advice and data to help manage the pandemic in Malaysia.
Last but not least, the conclusion.
In conclusion, we can see how Ministry of Health (MOH) reacts to manage the pandemic COVID-19 during this hard time. Ministry of Health has shown a great example of management that helped a lot to make sure our country recovered from this pandemic. This includes how the Ministry of Health has planned, organized decision-making and controlling their way to prove that they are very knowledgeable and have a great control of the situation even though it was unpredictable. Ministry of Health has implemented short and long-term plans that also involve both public and private sector to help each other, such as health guidelines and standard operation procedures that be followed until now to help to deal with this pandemic. MOH also success in organizing their resource to be more efficient. For example, they allocate workload to all members and have a work specialization to increase the work output. MOH also show a great decision making that help to recognize and selecting the best action to be taken. For example, MOH has made a decision to execute MCO to stop this virus from spreading. MOH also show a great control of the situation to make sure there are no outbreak. For example, MOH work to trace and isolate people that has been infected and work with police and military to impose mobility restriction. MOH was able to make a true analysis and have a great knowledge, attitudes and practice about COVID-19. This help us to understand and optimistic to have an eventual resolution. This shows that MOH has greatly managed the citizen and country during this hard time.